Cerebral palsy. Cerebral palsy is a progressive neuromuscular disorder causing mild to severe disabilities throughout life. The condition is manifested as a group of persisting qualitative motor disorders which appear in young children due to damage to the brain during delivery or due to some pathological conditions in the intrauterine life. The neurological problems are multiple but non-progressive in nature. Approximately 2 per 100 live births result in a child with cerebral palsy. Cerebral palsy is not hereditary. The causes of cerebral palsy include injury to the brain during delivery, as a complication of forceps delivery, lack of oxygen supply to the baby during delivery, and infections during delivery. Signs and symptoms of cerebral palsy include the signs and symptoms may not be similar in all babies affected, depending upon the damage to the brain, where there may be mild to severe lesions. Mild cases. 20% of children with cerebral palsy will have a mild disability. Moderate cases. 50% of children will have moderate disability. The affected children will require self-help for assisting their impaired ambulation capacity. In severe cases, which accounts for about 30% of the children with cerebral palsy, they are totally incapacitated and bedridden, and they will always need help and care from others. Abnormal findings in cerebral palsy. Children with cerebral palsy will have abnormal neonatal reflexes, stiffness of all muscles with awkward motion, extension of extremities on vertical suspension of the infant. There will be a scissoring of the lower limbs due to spasm of the abductor muscles of the thigh. And in severe cases, the back will bend backwards like in an arch. Children may have total or partial paralysis. They may have arrest of neurological and behavioral development. Swallowing may be difficult in some cases. There will be a drooling of saliva and mild to severe mental retardation. Abnormal movements are seen in some cases. Tremors with typical movements. If the cerebellum is affected, there will be a loss of muscle tone with difficulty in walking. Complete or partial loss of hearing. Speech may be affected, and there may be a squint, and other visual problems may be associated. Also, convulsions may be seen in some children. Cerebral palsy is diagnosed by detailed clinical examination and by eliminating other similar diseases like a brain tumor or progressive atrophy. All investigations like a CT scan, MRI, and routine investigations are needed to rule out other diseases. Management of cerebral palsy. General management. This includes proper nutrition and personal care. Symptomatic medicines are needed to reduce convulsions and muscle stiffness. Diazepam can be used to reduce spastic muscles, and dantrolene sodium helps to relax skeletal muscles. Physiotherapy. Here, massage, exercise, hydrotherapy are utilized to help with some of the symptoms of cerebral palsy. Special training is given to teach walking, swallowing, and talking, and the affected children are also trained to hold articles for routine activities. For rehabilitation, moral and social support should be given to these children. The children affected with cerebral palsy should be sent to special schools where special training can be given by trained staff. Depending on the disability, special instruments and machines are given for locomotion and to assist in day-to-day activities. Occupational therapy. This is given by occupational therapists. Some of the training will include job training so that individuals with cerebral palsy will be able to obtain suitable work when they are adults. I'd like to thank you so much for watching. Please don't forget to subscribe to get new informative videos.